In fiscal year 2021, through the Substance Abuse Prevention and Treatment Block Grant Program COVID-19 Supplemental Awards, the Ohio Department of Mental Health and Addiction Services, Ohio University's Voinovich School of Leadership and Public Service, and the Pacific Institute for Research and Evaluation came together to provide support to 5 urban behavioral health boards in Ohio as they engaged in community-based processes to address the impact of social determinants of health when planning for substance use disorder prevention and mental health promotion services and programming. This Community Collective Impact Model for Change 2.0, addressing social determinants of health in minority and underserved communities, was unique because the urban behavioral health boards received phased funding. Project directors began Phase 1 by working to bring together people and groups who had lived experience with health disparities and social determinants of health. Collaboratively and iteratively, community work groups created a data-driven impact statement in Phase 2. From this impact statement, work groups then created 3-year prevention services plans, detailing the goals, objectives, and action steps to be taken to address a specific social determinant of health within an identified priority population as the final initiative phase. The series of videos that follow were created by the communities for the communities and highlight the 3 phases of this initiative through photo voice, ethical photography for social change.
So the Montgomery County Alcohol, Drug Addiction, and Mental Health Services Board, ADAMIS, has convened a fluid work group, the Health Equity Steering Committee, with the purpose of guiding strategic planning and priorities and work plans through a lens of diversity, equity, and inclusion. This group comes together to identify resources, provide a whole community perspective, and facilitating building comprehensive strategic plans to address the various social determinants of health, from micro factors that are downstream moving towards midstream, all the way up to macro factors that are upstream level. These pieces of information are then utilized to inform planning and an equitable allocation of resources. This was done through our community conversations hosted by Dayton Food Bank and through training provided by ADAMIS and mental health first aid to the food bank staff.
So here at the food bank, we are the Food Bank Inc. and we are located in Montgomery County. We service 2.5 counties, Montgomery, Greene, and Preble counties of Ohio. But our base warehouse is located in the 45417 zip code. This is a zip code that has been historically marginalized and disinvested in for many years. And we chose purposely to build here because we wanted to create a space where we would be accessible to the community, and we just really chose to invest into this area where there had been so many years of disinvestment.
Food insecurity, really is just, to me, a lack of consistent food. I feel strongly about the word consistent in this just because it seems like, you can maybe get food one time, during a week, 1 week of the month, and then the rest of the month you're kind of struggling till, to get to the next month. So I feel like consistency is a big word in that. Obviously there's a lot of access as well, but I think lack of consistent food is a big deal there.
So it's important for people to come together to address food security for many reasons, because we can't do it by ourselves. One of our mottos here at the food bank is that we're not a food bank without our member agencies. So we can't solve everything by ourselves, and so we have 100+ member agencies throughout the community who are food pantries, homeless shelters, kids cafes, and that's one avenue of the path to solving hunger, right? So that's like the immediate need. We're getting our agencies the food that then people can get from them to get the food they need. But we're not the only people we are not going to be the people who solve hunger in Dayton. We're going to be part of it, and we need the community to do that. We need our neighbors who are in food insecurity to express what they need from us. We need people to volunteer. We need people to donate. We need organizations to help partner with us. And there's so many other issues that are tackled with hunger, racism, systemic racism, poverty, mental health issues. And there's already a lot of nonprofits doing that, and we can't solve any of those issues if we don't do it as a community.
The Self-Care Committee volunteered at the food bank to plant and serve flowers and other fruits and vegetables within the greenhouse space. They did this, 1, to share the knowledge about how to do these activities, and 2, to be able to enhance awareness of resources to providers that work in our community. Coming together and have a collective impact not only ensures that we are able to bring sustainable change into our community, but also impact intergenerational trauma.
The work we've just seen was guided in part by the CDC resource titled Promoting Health Equity, a resource to help communities address social determinants of health, which describes how considering the impact of social determinants of health when planning for prevention services can improve health outcomes and promote health equity across the lifespan. Additionally, the Ohio University and PIRE teams provided training, technical assistance, professional development, and networking opportunities. The results represent a truly community-led initiative focused on actualizing the impact statements to work towards health equity in each community.